Number of teenagers committing suicide certainly has surpassed the teen murder rate. That startling trend was recently shared by the CDC.
Channel 3's Mike Savino spoke to one mother who is using her experience to try to help others.
When he died, it was a complete shock to all of us here in our community.
For Ann Daigle, her son's death was unthinkable. At just 19, Brian Daigle died by suicide while he was away at college in 2011. But she also learned her son was part of a startling trend. Suicides among people ages 10 to 24 have jumped by more than 50% since 2000.
I wish I had known then what I know now. Maybe I would have treated him very differently.
A recent CDC report shows the suicide rate for that age group was relatively steady from 2000 to 2007. But since 2007, that rate has been on the rise. That growth has been even faster since 2013. This trend shows that since 2011, the suicide rate has been higher than the homicide rate for that age group. This decade, only accidental injuries have caused more deaths. Connecticut has seen a less dramatic rise. According to the Office of Medical Examiners, during that same time period, it went from 31 suicides annually to 39. Experts haven't been able to figure out the reason for this increase, but they say it's a warning sign for parents.
Sometimes what we think might just be typical teenage blues might be something more.
Dr. Laura Saunders is Assistant Director of Psychology at Hartford Hospital's Institute of Living. She says parents should be on the lookout for changes in their children's behavior. If you have concerns, the best way to approach someone is to ask. Saunders says be direct, including using words like suicide in the conversation.
Ask our kids what's going on. They don't always tell us, but we need to be an open conduit.
Daigle has been trying to change stigmas and encourage teens to be open. For the last 5 years, she's run the Brian Daigle Foundation. Part of the foundation's mission is suicide prevention. Its Lax to Live event uses high school lacrosse as a way to teach students about mental health. Mike Savino, Channel 3 Eyewitness News.
Now, if you are worried about a loved one, you can call 1-800-SUICIDE. We have information on more services right now on the Channel 3 app.